When we sit down with parents and talk to them about the results of our evaluation, there are many solutions that we may offer that are tailored to the particular findings and needs of the situation. Sometimes we'll recommend that we just do parent counseling, but parents can assume that whatever we do, they are going to be intimately involved. We believe at Lucy Daniels Center that there is no way to authentically help a child unless the parents are with us, and we aspire right from the start to form a very open, trusting, and deep collaboration with parents. We need to know from them, and they need to know from us. They need to have our guidance, and we need to have their knowledge of their child. So we'll always work with parents in some form of parent guidance. Sometimes we'll add to that parent-child meetings. Sometimes we're working with the child in a play therapy setting. And play therapy in the hands of Lucy Daniels clinicians is a very sensitive instrument, and it varies according to the needs of the child. Sometimes we're helping a child build coping skills and ways to have social skills. Sometimes it's more important for the child to reflect and achieve some self-understanding and ability to figure out why they do what they do. Whatever the blend of the play therapy, we prescribe the appropriate kind of therapy and can offer that. We also can provide medication for children when that's indicated. Parents should know that Lucy Daniels Center is very conservative about the use of medication in children. There are a number of reasons for that. We're concerned, as are many, about the impact of medication on a developing brain. We know already of many side effects, and some of them in and of themselves are concerning. Sometimes medication just covers up a problem and lets it sit and fester, and ultimately it comes back to cause difficulties for a child, and sometimes in a more severe form than back in the days before we started the medication. But sometimes medication is very important to help a child who's in a great deal of pain, or if there's a specific syndrome that they're having, that medication really is a necessary tool. So we use it when necessary, and we work with many children that come here who are on medication, and it's best for us to continue monitoring the medication. If medication does come up as an issue, parents can count on us to be very forthright and open about the pros and cons and put in front of them all the issues so that they can make the most informed decision. Another option that we have here at the Lucy Daniels Center is our early intervention program, which is a school-based psychoeducational program for children aged 3 to 6. And sometimes we'll make that recommendation when that's an appropriate match for child and family. There's one thing that's very important for families to understand when they come to the Lucy Daniels Center. We take as much time as necessary to understand the child, and then as much time as necessary to bring that child and family as far as possible. We're not a quick fix place. We're as fix as much as you can kind of place. We are dedicated, and we ask dedication from our parents and our children. And when we join with that time and that dedication and that effort, there really are sometimes some amazing results.